Thank you so much for your time today, Dr Shahzad Shah. It's really, really good to see you, as always.
A pleasure to be here with you, Emily. Thank you for inviting me.
Perfect. Would you mind just to give us a brief introduction about yourself, who you are, your background?
So my name's Shahzad Shah. I'm a consultant urologist at King's College Hospital here in Dubai. Although I deal with all core urology, my subspecialty interest is functional urology, which is to do with bladder dysfunction, both in males and females, which includes issues with flow, retentions, incontinence. So I deal with the functional aspects of urological symptoms.
So you're specialised in Rezūm steam therapy, which is a minimal invasive procedure. Could you just tell us a bit more about that?
It's one of the newer evolving technique for benign prostatic enlargement. You know, people as males, when they age, the prostate grows with them and it squeezes the water passage because the water passage passes through the prostate.
Yes.
And that then squeezes the outflow, and so men then have to force urine out. When it reaches a stage when tablets are no longer working, or they are just tired of having a tablet to take every day. This is a minimally invasive technique where we inject steam into the prostate. It's all over within 10 to 15 minutes. They do go home with a catheter, but that catheter is taken out after a week, and the results are evident soon after the catheter comes out. Much later, at 3 months, is when we have the true results, but it's minimally invasive. It's not as risky as the traditional transurethral resection of the prostate, where the patient had to stay in for a couple of nights. You had to irrigate the bladder, and you can do this for patients who have multiple comorbidities. So even if you're very high risk, you can still have the operation and not have a catheter to deal with retentions afterwards. And it's very popular because it also spares the young man from not seeing his ejaculate, where in the traditional operation they would lose the ejaculate because it went backwards, called retrograde ejaculation. With this therapy, the young men, they get to keep the ejaculation.
So it's not something that's just only in the older population, it can also happen in like middle-aged?
Yes, absolutely.
Okay.
Yeah. As long as they have documented bladder outflow obstruction, which requires a different set of investigations, but if their prostate is within the range that Rezūm can help, then these patients can benefit from this procedure. And I do offer that here at Dubai.
In Dubai, yeah. So even with Dubai having overall generally younger population compared to UK where we're from, do you find it still quite prevalent here? Like you have...
Not as much as you would in the UK. I think the cohort you get to see here is from 22 to 65 that I've come across.
Right.
Now that the golden visa has opened, you get to see the parents of these, the cohort of this subset. So now we're seeing more pathology come in and to Dubai, where originally you would have more of such pathology, say in LA or Abu Dhabi. Now with the golden visa opening up, more prospects for other people to come. Diversity in pathology and treatment that we offer is also increasing.
Yeah, because you've been here for a couple of years now, isn't it?
Yes.
Is it 2 years?
All thanks to you.
Yeah, I've been living here permanently since 2018. The last 2 years I've seen populations just growing rapidly. Have you noticed that?
Yeah, absolutely.
In your practice? It's getting very busy.
Yeah, exactly.
After 16 years of working in the NHS as a consultant, what was it that made you make that decision to relocate to Dubai?
That's a very interesting question, Emily. So my dad had passed away and my mum wasn't feeling so well. Yeah. And there were loads of other issues that I had to sort back home in Pakistan. And I was just waiting for that. One evening I realized I'd, apologized to many patients with regards to delays in their operations. Something, I was trying to fight a system where I didn't have any control of, and I just thought, I'll ask somebody, and I spoke to a few friends here, and then I got in touch with you, and you listened, and you didn't interrupt, you just listened. One thing led to another.
Yes. When you mentioned that you're relocating to Dubai to your colleagues, what did they say to you?
Right, so most were curious, a few were skeptical, but I think amongst all of them, they all wanted to make the move, if I'm very honest, but I think I was just brave to do it.
It's a huge decision. It's a very uncomfortable decision, isn't it?
Yes.
And it takes
giving
a lot
up everything.
Courage, yeah.
Yes, it requires a bit of you've just said it, courage, I think.
Courage, yeah. It's that unknown.
Yes.
Going into the unknown, yeah.
Fear of the unknown.
Yes, especially because in the NHS, you have the NHS pension, you have job security, so it must have felt quite uncomfortable to walk away from all of that.
Absolutely, like it was a big move, but my department was supportive. They did offer me a sabbatical, and so I came here. I just couldn't sort my stuff back home. And the colleagues I met at King's, I couldn't leave them now forever. It's just a bond that continues to
Wow.
grow. And the way they've embraced me and my work, my hospital, my team, I have to say, they've really looked after me. And so, I think it's all credit to them.
Yeah, we always get very positive feedback from the doctors working at King's College. You all tend to stay there long term, like no one moves.
That really made me feel at home.
So after building your identity in the UK NHS system, how did you find starting over from scratch here in Dubai, like, building your practice, getting your name known to the patients and colleagues to refer to you?
It's always the new doctor on the hospital, list, and so you're under the microscope. Can be daunting. I had lovely colleagues who really went out of their way to help me settle, embrace the culture, embrace the systems. Yeah, I really blended in after a couple of months. I didn't have any issues.
Before you found Allocation Assist, how did you find researching about Dubai, the jobs, the relocation? Did you find that, it was quite difficult to get certain information or?
Yes, so that's a very good question. I think so when I made that decision to contact you, I'd already done a lot of Googling, but I feel the information out there is very scattered and there's no map as to what you need to do. So there's no steps, which I think after speaking to you said, you'll take care of all that issue. So I didn't have to worry about any of those things because I had before you tried to contact another agency and I'd hit a dead end because they weren't responding. They weren't answering my emails. To be very honest, all that also made me not too serious about, making the move till such time I had that word from you to say, you'll take on my case. And then it was just, one step after another. And it was so smooth afterwards. I really have to thank you.
I remember actually when we connected and you came on board with us, things just went very smooth. Even though you did have those previous complications, I don't know, everything just worked really well. It just sort of happened.
It just felt like you knew exactly what the problem was. It wasn't not having the right documents. It was just, I think, the way you piece all the information together and speak to the right people. And I think that's where you guys really helped me out. And I can't thank you enough.
We are so proud to have you on board with us. Yeah, I think the thing with Dubai is that it's such a dynamic place. I mean, even for myself, it took me years to understand Dubai, like about 3.5 years before I really, was able to get the business off the ground because it's such an exciting place. It's so multicultural. We've got over 200 nationalities. Indeed. And it just takes time to work it out, I think. So I think that the reason why we are where we are today is just due to the experience, and more than 10 years now we've been in this industry. And I think
it shows that I think it doesn't really stop there. After you'd helped me get the license, get my job at King's, we keep contacting each other and we have these yearly things and you keep in touch with all your doctors, and that's a wonderful thing to do. Yes. Well done. Keep doing what you're doing.
Yeah, it's an incredible network. I'm so grateful to have all of the doctors, amazing people. So you started your job at King's College Hospital in Dubai in October 2023. Do you remember, I know it's quite a while ago now, but do you remember anything in particular that sort of surprised you about how things are done here in this region compared to UK? Or?
Yeah, the scale of the integration of the technology with the patient outcome systems, the diversity of the health workforce that work together it's a very patient-centered approach. The scale of technology that's involved here, I think it's just at a different level. AI is now very much into what we do at King's.
How are they incorporating AI with what you with your hospital?
Yeah, so we start every consultation, obviously, with the consent of the people involved. We transcript of our consultations is all AI, and so you don't have to waste time then writing up letters. It just comes on by itself. Imaging is taking on AI. We have further processes in place to integrate as much as AI into healthcare in a safe and productive manner. So all within the ethical boundaries that we have at the moment. Of
course. And, with regards to having access to the latest technology and equipment, can you think of a particular patient case? Obviously, you don't have to mention anything in specific details, but can you think of a specific patient case that it really made a difference because of the resources available?
Yeah, so we had a young patient from abroad who had a teleconsultation with me with regards to an issue he had with regards to voiding symptoms, and we planned his operation. He flew in the week after. He had the operation and he was back home in a few days, and he's just written me an email to say, he's not had to self-catheterize for the last year and a half now. And that email just says a lot.
Yeah.
It saved him so many further unnecessary procedures back in his home country.
Do you see a lot of patients coming from outside the UAE?
We're beginning to see
Really?
more of those now, yes.
Where do they mainly come from? Is it Africa?
Yeah,
or
yes,
a lot
Africa.
of people from Africa.
Yeah.
Yeah. It's very exciting, isn't it, where our industry is going?
Yeah, absolutely.
Yeah,
absolutely.
It's very exciting. So how much clinical freedom do you have here in Dubai compared to previous healthcare systems? So like with regards to making treatment decisions, like purely based on the clinical need?
It's palpably far more than what you had elsewhere. Within the bounds of ethics and best clinical evidence, you're not strangled by the system.
Yeah.
And here it's more patient-centered rather than number-centered. So as you had to show productivity with regards to the numbers, that not the complexity of the cases. Here, every patient, has individual treatments, and no two patients are the same. They have patient-centered management and outcomes as, patients would desire.
Yes. How much clinical freedom do you have working here in Dubai?
I think as much as I would have had in the NHS. That is where we all trained from. And whilst the rapidity of access to a clinician may be slightly delayed over there, which is far quicker here, I think with regards to what you can offer is pretty much the same what you would offer in any Western country.
Could you just describe a typical working week that you have here in Dubai now? Maybe perhaps compared to other healthcare systems you was working in previously?
Okay, so I would say I probably work more than I would have done in the UK, but the days are less stressful because I control my work, and I get to, despite me working more at the hospital, I find I'm more relaxed when I'm home, and we have better days, talking about things that aren't stressful in life. Overall, the work-life balance is on a different level here.
What aspects of Dubai surprised you when you first relocated here? So things that you didn't expect.
The scale of the development, the amount of cranes that you get to see in the city, the rapidity of the work that's being done, access to healthcare, the access to things you can just do on a phone app. It's amazing. It kind of spoils you to go back.
No, we all have to work hard.
Yes, everything is at your fingertips.
Yeah, so you can just focus on your work, and your spare time is your spare time. You don't have to worry about doing the cleaning or the washing.
No, exactly. So
everything's done for you.
There's
the shopping.
Services available for everything that you can possibly think of that you can just have on an app, and life becomes so much easier when you don't have to stress about a tap which is leaking or something that needs replacing. You can just worry about your work.
Everything's sorted.
Who can sort things for you.
Yeah. No, it's amazing, literally. I'm so grateful that I live here. As an adjunct clinical associate professor in the Gulf Medical University, how does teaching here compare to your previous experience of teaching?
So we have undergraduates from a variety of countries, and they bring in diversity to the new generation of doctors that are being polished for their roles in the coming years, and I'm fortunate to teach them. I'm also just come back from Oman doing a boot camp for the postgraduate urology trainees, and just speaking to them, talking to them. It's a pleasure to be involved in teaching and to be able to play my part. And the next generation of doctors are being trained from this region.
How long would you say that it took you to feel comfortable professionally and personally, like to sort of be settled here in Dubai? How long did it take you?
I think it can take you between 2 and 6 months to fully integrate into the system.
Quick.
Yes. I think it all depends on the kind of people that meet you and embrace you and then take you forward. So it can vary. I'm sure other people will have other experiences, but for me, by 6 months, I felt I was...
I can see that, actually. How was your experience working with Allocation Assist?
Oh, it's been brilliant. You know that. And I've always been your ambassador.
Yes.
Because you really looked after me when, I didn't know what to do, to be honest. And I'd given up hope at some stage, thinking I might just stay there. But then, you kept the ball rolling, and one thing led to another, and it was no looking back. In fact, I still remember I was in my study when we had that call, and I showed you my garden, and you said, well, come over here, see how it is, and there I am.
Thank you so much.